Georgia doesn't have the largest disparities, but it's in the top 10, so to speak. It's a big issue. That's not just between rural and urban, that's all of the different categories that humans and colors and flavors that we come in. Healthcare impacts each one differently.
We tend to focus where we see news reports. Those news reports are very heavily focused on metropolitan areas. That means that it leaves many other counties and thousands of other people where there's not a news camera, where there's not a lot of publicity. And so these problems persist out there in these small communities. But yes, rural communities have special problems and they're being left behind.
As one of the challenges of rural healthcare is that there's access issues, where there's not as many doctors per capita as in urban areas. I mean, there's some stories where someone who's 7 years old, living by themselves, they need to see a doctor, they'll call an ambulance, and it's for a checkup, but they have no other way really to get to where they need to go.
When a hospital does close, those residents there don't have the facilities that are needed. And for instance, we have a child that's very allergic to bees. Well, if the child gets stung in the county that there is no hospital, and even if the parents have the EpiPen, they still must respond within 20 minutes or less to a facility.
As I say, I really didn't know what to expect from this conference because I hadn't anticipated hearing all the thoughtful policy that people have been presenting. The CEO panel, for example, was particularly instructive. Those guys are all already solving problems that we think they need to solve. They just don't label it the way we label it.
There are little changes taking place on hundreds of different venues, and none of the changes in themselves are probably going to change healthcare entirely. But over the course of time, as these hundreds of things are implemented, really, let's put it this way, healthcare will look a little different 5 years from now than it does today, largely because of the technology that's being implemented.
So as a scholar and academic, often we're only talking to each other within our ivory towers. I think the challenge for us is, as we develop the evidence base that should inform policy, we need to go out there and actually talk to policymakers, and we need to talk to the public as well, say, here's why you should care about this issue. And we don't do a good enough job of that.
Healthcare is bigger than just your insurance. It's food deserts. It's the food that you get served at school. It's lifestyle choices. It's it ranges the gambit, and this allows all the institutions and all the stakeholders in healthcare to kind of come to the table and talk about, this is a big issue, this is an overarching issue, it impacts X, Y, and Z. Let's figure out how we can all come together and make it at least a safe place to live, because it's literally a life or death situation when you get down to it.
So this is sharing ideas, but really networking with those that have knowledge to say, I've tried this and this is what worked. If I could do it again, I would do it this way. And to really get with your peers that's on a common ground. And I think the overall attention that rural healthcare is getting is exciting, and I think we have the opportunity to really make some successes in the future for the populations that we serve.